Root canal treatment or RCT, isn't it a very commonly used word? Or most of you watching this video might even have got a root canal treatment done in their mouth. Hi, this is Dr. Seema Chowda from DK Dental Clinic and I am a microendodontist by profession. Today I want to explain it to you what exactly is this root canal treatment and how is it done. See your tooth in the oral cavity. This is the crown portion of the tooth that is seen in the mouth. However, double this size is the root portion of the tooth which lies inside the bone. A tooth can have one root, two roots or maybe three roots. So in the root portion that you saw, this is that root portion. In the center of this root portion there is a space. In this space there are blood vessels and nerves which keeps your tooth living. This space is known as the root canal space and hence the treatment is known as the root canal treatment. So when there is decay in your tooth that reaches this root canal space, you need a root canal treatment, and this space is actually accessed, cleaned, shaped and filled with a new filling material in your root canal treatment. So when will you actually need a root canal treatment? As seen in that photo, when the decay reaches your root canals, this is when a root canal treatment is required. What symptoms you will have when you need a root canal treatment? Most commonly, pain in your tooth. You will not be able to eat hot food, cold food. You might not be able to have tea. You might have constant lingering pain in your entire jaw. You might have severe headache. You might not be able to sleep at night. These are the common symptoms that indicate that you are actually in need of a root canal treatment. So let's see now each and every step of how your root canal treatment will be done. First of all, anesthesia will be administered to that particular tooth so that the tooth becomes numb. After that, the decayed portion of the tooth is removed and the root canals which lie inside the tooth, that access is gained to those canals. As you can see, those tiny black openings, these are the openings to the canals inside the root. This is the first step of the root canal treatment. The nerve that is actually removed from your tooth is the one that is shown in the video. The nerve that comes out from your tooth looks like this. In the second step, now the length of each and every root of the tooth is measured with the help of radiographs, and it is also confirmed with a device which is known as electronic apex locator. This step is done because the length for each and every tooth and each and every root is different. After that, the cleaning and shaping of your canals starts. The cleaning of the canals is done with a mechanical device which cleans and shapes your canals, and it is also done with the help of various medicaments. Various medicaments are injected inside your root canal so that all the microorganisms, all the debris, all the infection that is there inside your root canal gets clean. After this step, then an instrument known as an activator is used to activate the medicament that was placed inside the tooth so that it more effectively cleans your canal and makes it free of all the microorganisms and all the infection. In the third and the last step, first of all, a glue kind of thing is injected inside your canals so that this will seal the final filling material that is to be placed inside the canal. A biocompatible material, most commonly gutta percha, is injected now inside your canal to fill the empty spaces that have been cleaned in the previous step. After that, once the canals are sealed, the opening made through the tooth is also sealed with a permanent filling material. This is the last step of your root canal treatment. So after that permanent restoration is done, now the dentist will give you option whether this tooth now needs a crown or it does not need a crown, or if it needs a crown, what options are suitable for your particular tooth, and accordingly they'll guide you for the crown procedure. Till the crown is done, once the root canal treatment is complete, now your tooth will be free of pain, you will be comfortable now. But the thing that you need to take care is you need not chew hard things like nuts, dry fruits with that tooth until it is secured by a crown. This is behind the scene, how we actually prepare ourselves before we start your root canal treatment. Once the armamentarium is ready, we put in the microscope on the patient's mouth to focus the tooth, and then your root canal treatment starts. The entire procedure, when done under the microscope, can be seen live on the screen by the patient as well as the patient's relative. Testimonials from some of our patients who have got their root canal treatment done. Now let me address some of the common questions that our patients usually ask us about the root canal treatment. So the most commonly asked question is, will my root canal treatment be painful? No, absolutely not. Because we already administer anesthesia before starting the procedure, so your root canal treatment during the procedure is not at all going to be painful. Most commonly asked question is that how many sittings I require for my root canal? Normally, in today's world, with the today's technology, the root canal treatments are done in a single appointment. However, if your tooth has infection in it, you might require more than one, maybe 2 or 3 visits for your root canal treatment. What will be the duration for my treatment? The duration for the treatment is usually 60 to 90 minutes depending on the complexity of your tooth and the complexity of your root canals. The other most commonly addressed question is that how long will my tooth last after my root canal treatment is done? So if done properly, if your body responds properly, the root canal treated tooth may last to you for lifetime as well. It will depend upon multiple factors, that how your root canal was done, how efficiently it was done, whether everything was treated well, how well a crown was done, and how are you preserving the tooth and taking care of it. Depending on all these factors, it will decide the life of your tooth. The other question is, after I get my root canal treatment done, will the tooth be painful again? No, because you have got a procedure done, it might be a bit discomfort, you might have a bit of pain, a very mild pain which can be managed by the analgesics for 1 or 2 days maximum. Otherwise, your tooth will be absolutely comfortable in a day or 2 after your treatment is done. If you have any other questions, other than the questions addressed by me, you can let us know in the comment section that what do you think or what confusion you still have about the root canal treatment. We will surely address it and come back to you with the answer in the next video.